Good evening, everyone. This is Moshe Frank, streaming from the Levine Art Gallery. Tonight we have a special guest. We have Bruce Backman, former Fox News analyst, as well as aide to Governor Pataki during 9/11. Bruce, is that correct?
I would say I was a chief aide, but I worked for the governor 9/11. Yeah, I was there. I was very young, but I
So,
was there.
Bruce, tonight I wanted to speak about government leadership during the time of crisis, as you have experienced during 9/11. So you've seen a lot more than most people, close up firsthand. How would you say today's, I guess I'm going to start from bottom up or top to bottom, president down to mayor or mayor up to president, whichever. Let's start from the president down. How do you feel they're handling this crisis?
I mean, I think today everybody's handling it as well as they can. I think that nobody really knows what to do. I don't think, and I think because of that, we have to do the things we're doing. You know, the social distancing is important. Staying in your house as much as you can is important. You know, unfortunately, staying away from religious Jewish places and other public places is important. Nobody really knows what the future holds, which makes people very nervous and scared. Fear is a very scary thing. But I think where we're holding today, I think everybody's kind of just doing the best they can, just to keep moving and keep people safe. Uh, but I think if we go back in time, and at some point we're going to have to go back in time, because God willing, the pandemic will be over soon. No more people will die. No more people will get sick. Mitzvah Hashem, it should end quickly. It should end now. Mashiach should come. But we have to start asking questions now about how did we get here? How did it get to be like this? Are we doing this? And is this the only way this could have been done? I think right now, I think this is the way it has to be. I've been, for weeks, I haven't really left my house very much. I stopped taking my children to shul before Purim already. I already kind of saw the writing on the wall, unfortunately, and which some people at the time probably thought was drastic, but, I followed the situation and I just felt it was warranted. Then the schools closed and then the stores closed and the businesses closed. And, now everybody's homebound going into a very unusual Pesach.
So if you were
Pesach is a
with,
special time.
if you were the president, you had the intelligence he had, what would you do, Bruce?
When, now or a long time
No,
ago?
a month ago.
I mean, it's some people are going to call it Monday morning quarterbacking, but I think there's a lot of questions that have to be asked, and I think it's okay to ask them. I've spoken to you before I came on today, and the conversations with other people are: is it fair to ask other questions about this? Did it have to be like this? And I'm not convinced it had to be like this. I think it has to be like this now, but I don't know if it had to be like this in January and February. And in those months, I believe that there are steps we could have taken as a country with the information that was available to us then. Maybe some of the information was being held from the United States and being held from our leaders and being held from our people of power. But only time will tell as information starts to make its way out of Washington circles via freedom of information requests and greater reporting and historical reviews. We'll find out what we knew and when we knew it, and what choices were available to us. I could tell you this, that whenever we make decisions as a country, we have to try to weigh all the different ramifications of our decisions unfortunately, without strictly focusing on things like the virus. Obviously, once the virus takes hold and it's showing that how dangerous and scary it is, then we have no choice but to distance and all the rest of it. I don't think there's any choice today. And maybe there was no choice then. I mean, but I'm of the opinion that other countries have dealt with similar viruses before, and they made decisions to do things differently, and they were better prepared than we were. I mean, there'll be a lot of excuses about it, but it's
For example,
true. I mean, for example, I'll tell you something funny. I showed some friends of mine when the Wuhan cases were very severe, and there was a lot of videos leaving China at some of the remedies that were being taken within China, with social distancing and things like that, and about the temperature in public and the face masks, and don't leave your house, and you have to hide in your house. And for some people, for some reason, people realized that the virus may come here because there were already cases, even though there were very, very few. And eventually the virus will make its way here, conceivably. And for some reason, we thought that we'd be able to handle it differently. Well, I don't know if that's 100% true. I mean, the Chinese were in the situation they're in because they were in denial for a month. And it's possible we were in denial for a while also, thinking that, prominent officials from both political parties got on television and said things repeatedly that, oh yeah, don't worry, it's not a big issue here. I mean, all the biggest hawks today, if you want to call them that, for social distancing and all these different measures, as recently as less than 30 days ago, we're telling people that elbow bump in public and take public transportation and don't worry about flying and everything's going to be okay. And go to Chinese parades, even though everybody knew that that could be a hotspot because the virus was coming from China. And don't worry. I mean, in Italy themselves, at one point, they were telling people that they should, hug an Italian, and not an Italian should hug a Chinese person, so they shouldn't feel discriminated against within their society. I mean, we kind of had information, and I think that we were a little complacent, maybe even arrogant. And I think it puts us where we are today. It's not popular, and some people may not want to hear it, but we have to be prepared, because this will probably not be the last pandemic that faces the Western
Bruce,
Hemisphere and
question.
industrialized countries. And
You own
this can't happen again.
Bruce, you own a
It could
business.
happen again that we have a pandemic, but we can't do this again.
You own a business. Did you take precautions before the president did, or you only after president
I'll
announced?
tell you something funny. I am in the Pesach hotel business today, despite my political background. And my wife and I went to Florida at the beginning of February for a few days. I had some business down there, and she came. And I think it was like February 7th or 6th we came home. It was a Thursday. We flew out of Fort Lauderdale, and I got to the airport, and we were going to TSA, and I noticed that one of the TSA agents was wearing a mask. So I asked the agent, I said, why are you wearing a mask? So she says, oh, there's this virus in China, and the TSA said we can wear masks if we want to. It's up to us. They made it available. Some people wore masks, others didn't. That struck me as shocking. The TSA was giving out masks to some of their employees, optional maybe, but nonetheless, they still did. And I came home and I called my insurance broker within a day or two. And I said, hey, what's this? There's this virus over in Asia. Is there any kind of cancellation insurance or protection? I have a Pesach hotel, Pesach in the Northeast. It's going to be in Virginia. And you've sold me all my other insurances, workman's compensation and stuff. Can you look into any kind of insurance I could take for this? Because I knew my basic liability wasn't going to cover it. Because, I mean, I just know it doesn't. And he says, yeah, I'll look around. And then he told me that, oh, as of January 22nd, January 18th, depending on the provider, there's no more insurance coverage. And I mentioned it at a meeting. I had a meeting with some senior staff a few days later, and we were talking about, things I wanted to do. And I said, yeah, I gotta get on my insurance broker, because I really wanted to research this, which meant you're talking 2 months ago, I was quite familiar that something's wrong. You went back to 2 months, not 1 month, two. And there are people in government, obviously, who knew that there was a problem, because they were telling TSA agents from Homeland Security they should be wearing masks. And that probably wasn't a decision that was made on the 7th. It was probably something that was already discussed in January. So people knew that something was up. The question is did we have a plan? George W. Bush gave a speech, I think in 2005, which has become much publicized again, where he talked about the fear of global pandemics. Allegedly, he went for the summer to his ranch down in Texas, and he read a book on the 1918 flu, and he came back to Washington, and he wanted to have a pandemic plan of action if, God forbid, a pandemic were to ever strike the United States. A lot of his staff were like, hey, we're fighting a war in Iraq, we're fighting this, we're fighting that. You're not all that popular right now, Katrina. I mean, and this is what you're focused on? And he says, by the time, when a pandemic comes, it's going to be too late to have a plan. And I think we're learning that the lack of a plan, and I don't care what anybody says, we clearly did not have a plan. I mean, anybody who says we had a plan, I mean, at the very least, we have to acknowledge it wasn't a very good one. And we have to have a plan of what to do and how to handle this, and what preparations are available for people. And we have to level with the American people. We can't treat the American people like children.
You're basically saying the government was clearly not prepared, and however, based on your TSA experience,
I don't think it was the government was not prepared. I don't think it was the government was not prepared. I think the government, I don't know if a pandemic plan would have solved all of the problems we're facing today and would have stopped anybody from getting sick, and chas v'shalom, or God forbid, anybody from getting deathly ill, that they would even, chas v'shalom, they would die, or they'd be in the hospital and ramification. I don't think that's, but you can see by the day-to-day changes of what we're doing and how we're doing it, and you can do this and you can do that, and it's constantly changing and it's constantly uplifting, and don't take this medicine and don't take that medicine, and they'll tell you, oh, we didn't know, we weren't aware. But listen, it's not my job. I'm a taxpayer like everybody else. I'm a business owner and a taxpayer, and as a business owner and a taxpayer, I expect and I'm hopeful that my government is going to, in matters like this, is going to be as cautious as they can be. I think they're doing that now, and I think it's saving lives for sure by keeping people home.
Bottom line is,
people say.
Bottom line is, it's 2020. The government was clearly not prepared, no experience, and they have no plan. And now they're just playing catch up. Correct?
I don't want to say they were. I don't want to go that far, but if they were prepared, they weren't well prepared. And because they weren't prepared, we weren't prepared.
However, you say in government itself.
American taxpayers. Hold on,
Bruce. The fact that TSA was telling people about this disease, that you could wear a mask well before anyone else.
No, that was for their employees. They could wear a mask.
Correct. So before anything, certain parts of government, which is a TSA, knew and we realized a threat, and told
let
their
me be more
employees
blunt. It's quite a lot of hubris to watch press conference after press conference and speech after speech of people saying, don't wear a mask, it doesn't protect you, when the first thing the TSA told its staff was that they could wear an optional mask if they wanted to. It's quite a bit of, it's quite a stretch. I mean, I've never bought the line that masks aren't safer. I mean, if this virus is really here and it's as contagious as it appears to be, then masks are only going to help you. They're not going to hurt you. And if you have access to a mask, that doesn't mean you should hoard 500,000 masks in your house. It means that if you have a mask or you keep masks in your house, like so many people do for all different kinds of reasons, the same thing with rubber gloves, that you should wear them when doing things and handling certain things. And people have Lysol in their house. People have a lot of the products you need to keep yourself safe. I don't know if they have the best masks like the doctors.
So how would you rate, Bruce, 1 to 10? How did the president? How did he deal with the situation? How is he dealing with it now? 1 to 10. Give us a rating.
Different stages, I think.
Bruce, I think your camera
like
tilted.
President.
Hold on, Bruce. I think your camera tilted.
It did.
There we go. Now we're back. Oh.
I think
in preparedness, we give him a 1, and now he's doing what?
No, I give. You know what? I'll tell you something. When everybody's to blame, nobody's to blame. I mean, what's his preparedness? I think it was very, very poor. I don't think it was poor. I think the president's relying on the information that he's given. And the information that he's given comes from the head of the CDC, or the head of the infectious diseases department within the CDC, Anthony Fauci. And Anthony Fauci was on television in January telling people that it's nothing to really worry about, and it's public. You can watch it. And many things were said by other prominent officials after that. You listen to your experts. But people have to remember
Regarding
something in
this,
life, and this is controversial. You listen to your experts, but experts sometimes make mistakes. Experts sometimes are wrong. Obviously, somebody somewhere knew that this was serious. If they're telling people at TSA that they should be wearing optional masks if they want in February 6th, somebody somewhere knew something earlier than it's being let on. That's all I'm ever saying. And if we would have realized that sooner, maybe we wouldn't have been able to stop it, but we may have been able to mitigate it a little bit more. And mitigating a little bit more would have been a good thing. And maybe
so
mitigating wouldn't have necessarily had to come at the
government,
expense of shutting down the entire economy and
part
deciding
of
which
government,
businesses are
Bruce,
essential and which businesses are not.
Bruce, so part of government and
No
private
offense to
industry.
anybody, but why is a liquor store an essential business?
Hold on, let me just finish
I
the
mean, I
last.
could see why it is for, leading into the holidays, but there are a lot of other quote unquote quasi-essential businesses people have.
Bruce, let's take one subject at a time.
I mean,
So the private
sure,
insurance
go ahead.
industry knew, and therefore they're stopped issuing coverage for that. In addition to
The private
TSA,
insurance industry already knew by January 18th, 19th, by the 22nd, you couldn't buy another policy.
okay, so they knew,
There was no
TSA
policies to
knew,
buy.
TSA knew, the government didn't know.
People knew.
The leadership, executive leadership did not know or care, or whatever the right
I
word would be.
don't. I think people couldn't fathom such a thing could happen in America. I think people felt that in the United States we'd be able to overcome such a thing. We had tremendous faith in our leaders, in our medical facilities. We also had the vision that this is some foreign virus that was never going to really make its way here. Because SARS and MERS and other viruses never really impacted the same way. They were scary. We were nervous about them, but they didn't really make their way here that way. Not where the entire economy and people are incapacitated and children are
So,
sent home from
Bruce,
schools.
if we could use September 11th in comparison, something that happened in our lifetime that we can remember, the U.S. was never prepared for it, and obviously life has changed greatly, especially when it comes to travel, security,
The U.S. was a
immigration
little
since
bit
then.
more prepared. The U.S. was a little more prepared. Joe Lhota was deputy mayor under Rudy Giuliani, and I had the privilege of working for Joe Lhota when he ran for mayor in 2013. And Joe Lhota is probably one of the smartest, most capable people that I've ever come across. And Joe Lhota came up with a plan right after Rudy took over, which was probably in the shadows of in the early 90s bombing of the World Trade Center, which was we have to have a plan what to do if all hell breaks loose in New
Okay,
York.
so
We
there
have
was
to
a
have a plan.
reference point, Bruce.
So
There was a
on
reference
9/11,
point during his
there
lifetime. Bruce,
was a plan in place.
right? There was a
I don't
reference
know if
point
every
in
part
their
of the
lifetime.
plan worked, but there
There
was
was a
something
reference
to fall
point,
back on.
Bruce. There's a reference point in their lifetime that they could see there is this type of threat, and therefore we need a plan.
I mean,
In
this is
contrast
not,
to Corona.
no offense, this is not the first pandemic since the 1918 Spanish flu. There was Asian pandemics in 1957. We had the bird flu in 2009. I mean, who was everybody fooling over here? We've had other quasi-pandemics and illness outbreaks in the United States. Obviously, maybe not to this degree and not this severe and not this dangerous and not this frightening, but we've kind of had this before. I mean, President Bush felt the need to make a plan and spend $7 billion allegedly in 2005 on starting up this whole pandemic preparedness plan. So we've been focused on pandemics. I think that pandemic plan kind of got raided over the years and people kind of lost sight of it. But Bush was very scared that another pandemic was going to come. And, and unfortunately it's here. And we've lost so many special people, throughout New York, the country, and the world. One chashuv rabbi followed by one chashuv rabbi followed by tzaddikus, followed by just, you look at the list of people who've been lost to this virus, and it's like the creme de la creme. It's the best of the best.
Bruce, what do you
You
think
know,
about the way the government closed business down? Could they have separated the young and the old? How does the U.S. respond
I
compared to other
think if
countries?
we had realized I think if we had known more about the virus earlier, or we had if we had planned better, honestly, and we'd known more earlier, I think we may have been able to be a little bit better prepared. There are people who will tell me that's not true and this had to be this way, but I'll tell you this. When this is over, there will be a plan so that, God forbid, anything like this ever happens again, it won't happen like this. No one is ever going to want to do it this way again. You have to realize that. So anybody who says that is being dishonest, because we cannot take the risk as a country to arbitrarily or for safety reasons shut down the economy to this level, causing, there's pictures on the Drudge Report today of miles and miles of people lining up to go to food banks. You have to do what you have to do, but you have to find a way to do it where we are able to, be a little bit more wise in how we do things. Yeah, of course, some businesses are going to have to shut down. Of course, you're going to have to social distance. Of course, you're going to have to wear gloves, not touch your face, perhaps wear a face mask in the street, perhaps in your place of work. Yeah, there's going to be challenges. And these are things that people are going to have to get used to, unfortunately.
Bruce,
But
here's my
I believe
stupid
we could do
question.
better than this.
Bruce, my stupid question is,
Yeah, sure.
why don't we split young and old, high risk, low risk, and then move forward with that?
I think we could have done that if we would have done it sooner. I think once if you would have started to do that, let's say when the TSA was telling the people to wear face masks in the February, I think you would have had a little more success at it. I think, unfortunately, like George W. Bush says, is by the time the pandemic gets here, it's too late. I mean, you can only really do that stuff if you do it before. It's like preventative medicine. It only works if it's to prevent. You can't really do it once you're sick. Once you're sick, preventative medicine or preventative dentistry doesn't fix a cavity. You want to not have cavities, you do preventative dentistry. Once you have cavities, well, you're going to have to get fillings and caps and crowns and the rest of it. Now we're doing what we have to do to protect Americans. And
do you have a prediction?
In that regard,
Bruce,
we're doing it well.
Do you predict any day that things are going to start getting back to normal? Business open, or no prediction yet?
I think things are going to start to get back to normal probably in early May. I don't think things are going to get back totally to normal probably till the beginning of June, but I do see it getting back to normal at the beginning of May. I am hopeful, let's put it this way, I'm hopeful that they're going to start to get back to normal at the beginning of May. I pray that it gets back to normal at the beginning of May, but when we get back to normal, it's not going to be normal for a while. It's going to take time. I mean, true normalcy isn't probably going to come for a couple months.
Bruce, I must say you seem pretty calm for suffering heavy losses on your cancellation of your Passover hotel program. So I'm pretty impressed, if I may say, Bruce.
I mean, we lost. I mean, before the virus hit, I was at 82% sold out. We were doing well. I'm not a rich person, but it was a successful business. I mean, it was relatively successful. I mean, we were selling rooms and we had happy clients. And then, then everything just started. And first we were nervous that people wouldn't come and they wouldn't pay their deposits. And then all the programs were speaking about this. Every program went through this. We decided to try to pay people back in full. We liquidated our accounts for this year of what I have available to me to pay people back what we could now. We were able to send people 65% of their deposits prepaid, which was the most important thing to me, was to make sure we got money in people's hands because they had given us money to make Pesach. And now I wanted to make sure that I know that everybody's going through tough times, that people got back money so they could make Pesach for their families. They shouldn't have to wait it out. And then we said, we'll pay the back of the balance in equal payments over 3 years. If I could pay them back sooner, I would. I can't commit to that though right now based on the way things are.
What's your predictions on real?
We made a plan we made a plan that allowed me to stay in business, to support our clients, and to do what was right by our guests.
What's your predictions for 2020 elections?
That's too early to say. I mean, it's going to be a close election.
If the election was tonight,
I don't know. I don't think the polling's very good. I'd say that Trump probably light edge if people are really going to the polls tonight. But on the other hand, I think that after this is all done, I mean, it depends how we come out of this. You have to remember something. Whether you like the way the president's handled this or you don't, you have to realize that the president is planning on getting out to people over $2 trillion in the stimulus packages. And Democrats have known for years that giving up people money buys votes. And there's no reason to believe that all the money that the president's going to be giving out to small businesses, which will benefit some workers, which will benefit, a variety of people in different places, will probably lead to positive ramifications for him in the polls. But the Democrats voted unanimously for the legislation as well, so they'll all be able to take credit for it. But at the end of the day, it's being distributed by his Treasury Secretary. So depending on how the stimulus goes, that'll probably dictate, how he does in the elections. And it'll still be a nasty election. The media still hates him. But the president is resilient and he's made mistakes, but he's also done some smart stuff too. I mean, the travel ban to China was a smart move. I kind of wish we'd had a travel ban to more places at the time. I think this is controversial in some quarters, but I think his pushing the hydrochloroquine constantly at press conferences, knowing that the medical establishment is against it, may prove to be genius, because the anecdotal results, the anecdotal evidence is there that it's effective. And when you're dealing with a crisis which changes hour by hour, day by day, no offense to doctors, and I'm not an epidemiologist or a physician by any means, and I'm not really qualified to make a statement, but when all hell breaks loose, you throw everything against the wall and you hope something sticks.
Wartime
Yeah,
medicine.
sure. I mean, it's dangerous. What?
Wartime
I
medicine.
mean, it's not wartime medicine. It's you're trying. It's like you're trying to save a stinking ship. There's a lot of ways to save a sinking ship, but at the end of the day, if you have some garbage bags on the floor, you try to plug the hole. You'll take whatever you can find. I mean, if you could plug the hole with candy bar wrappers, you'll do it. So I think there's a certain sense of desperation on the part of the public. Plus, I think people want to hear good news. The president's very good at reading the psyche of the American people. He always has been. I mean, that's why he's underestimated and he constantly overperforms, because I think he understands the American people. But we have to be honest that, we have to save as many people as we can now. We have to save as many people as we can now. We have to take all the precautions we can now, especially going into the holidays. I encourage people not to decide that it's time to be lax with the Seder's coming, to invite family members. I would much rather celebrate many more Starim with older family members with health issues to come than to push it for this year. I know that's painful, but I mean, there's a lot of ways. My own in-laws are going to be in their home in Brooklyn. My parents are in Montreal. We won't be together for the holidays. We always are, usually at the hotel, but I mean, we won't be together. But we're not together now because we want to be together in the future. But when we talk about things that were not planned well, I think the one that really pains me the most is we didn't really have a plan to deal with everybody else who gets sick in America. If you needed chemotherapy or you need cancer treatments or you have kidney issues or a variety of other things, I mean, you can't really get into the hospital these days. Cancer surgeries are considered elective today, unless if you're stage 4, I guess, but I wouldn't even know that for a fact. I'm just assuming, because I know people intimately who desperately need surgeries and they can't get them now. And there's a lot of people who aren't being seen by physicians and doctors because they can't be seen, because the doctors are overrun with COVID, which leads me to, why didn't we have COVID hospital plans set up and leave other hospitals COVID free so that other people could get certain vital treatments for themselves? Now, it could be happening, but the intimate information I have, which is anecdotal and firsthand of people that I know, are not able to get into the hospital. I mean, they can't be seen by a doctor in person. Everything's over Skype or Zoom.
I think that Navy Hospital was supposed to be designated for non-COVID and the Javits are non-COVID.
That's great. Who knows to go to the Navy Hospital? Is your physician at the Navy Hospital? If you're supposed to have a cancer treatment, is that where your oncologist is? I mean, I don't know. I'm asking a question. I'm not saying I know the answer.
I don't know.
But I mean, when you make a plan, when you have a plan, that should be part of the plan, because the goal is to save lives, right? As many lives as possible, and not all lives. All lives matter. All lives matter. And in a time like this, when there's so many people suffering and in so much pain, we didn't even get to the financial hardship. Just we have to make sure we have a plan. I mean, I saw Scott Stringer, Chris, saying that Donald Trump has blood on his hands because his mother passed away, which I'm very sorry about. Nobody wants him to lose his mother. You know, God forbid. I mean, I'm sure he loved his mother very much. I'm sure she was a fine lady. And the fact that he's dealing with this now, being an elected official, is probably painful for him firsthand, and probably for his extended family too, and her friends. And he was complaining that the boat hospital doesn't take COVID people. Well, I thought that was the point. You know, I thought we were trying to have a place that people can go who need trauma issues and dealt with if they have nowhere to go. I mean, you know, I have a family member who called me tonight that her son fell off the bed, my sister, and he needed to get stitches, and they didn't know if they should bring him to the hospital. They had paramedics in the house. My sister told me she was Lysol. She wanted to Lysol the whole house. She was so scared the paramedics came over. I mean, I would be scared too, I guess, these days. I guess everybody would be scared if they had people out, if they're really keeping to the social distancing, if someone came into their house. But at the same time, I guess it's better he stays home. She doesn't know what to do. I think they finally found a doctor who was going to see him. But I mean, these are day-to-day issues that we're dealing with. And you know that stitches and concussions and bruises could develop the worst things if they're not properly seen by a doctor. You know,
Bruce, thank
we
you.
have to tend to these matters as well.
Bruce, thank you so much for this interview. I really enjoy your different perspective on the matter,
It's
and we
over
hope to.
already. I could talk for hours.
I know it's getting a little
It's
late.
too much.
Getting a little late,
It's
but
getting late
I
for me too. I just want to
think
wish everybody, before we go, just let me wish everybody a happy and healthy and safe Pesach. People should stay home with their families. They should enjoy their families, and they should daven, and they should know that soon it's going to be over. And for people who've lost loved ones, many of whom are my friends, the Metzgers in Manhattan, the Heber family, they lost their grandfather and father, Asher Heber, who was somebody Rabbi Heber, who I knew and liked very much. Amongst the many other special people in the Crown Heights community, I have guests for Pesach who I found out, reaching out to them, also passed away. But all their families, everybody's family, and Yudi Dukes, you know, a dear friend of ours from the 5 towns where I live, should have a refuah shlema. You know, him and his wife, they're home, and everybody's davening for them. But we should all hope that Mashiach comes, and that this gets better very soon. But nonetheless, we have to daven, pray, and take precautions, and hope for the best and be positive, because positive thinking really does make a difference,
thank you
no
so
matter how
much.
rough and tough things get. You're welcome.
This
Thank you,
is
Moshe.
this is Bruce Backman and Moshe Frank streaming from the Levium
Thank,
Archives.
thank you. Bye-bye.